Supplements are, they have a different name. They have a different meaning for different people. And so let me begin by clarifying what I think of in terms of supplements. First of all, supplements are not natural medicines like saw palmetto, St. John's wort, gugu lipid, and those kind of things, which are natural medicines that come from plants that have some pharmacologic effects. I'm not talking about those. When I talk about supplements, I'm talking about something supplementing what should be in the food, or at least should be part of our natural environment. And so what we end up supplementing are vitamins and minerals. That's what's sold in isolated, concentrated packages in terms of vitamin and mineral pills and tablets and shots sometimes. These are isolated, concentrated nutrients, a single nutrient usually, or maybe it could be several nutrients mixed together, but they're isolated, concentrated nutrients. Now, when these nutrients are in plants as vitamins and minerals, they're in an environment, a milieu, an environment that all works together in harmony, through hundreds of millions of years of evolution. What's happened is we've developed an interaction between beings, us being one of them, the human being, and the environment around us, and that being the food. And so in these natural arrangements, this harmony, and it just comes together as food. If we consume it in that form, in those kind of packages, these vitamins and minerals are essential. Without them, you develop diseases like beriberi and scurvy and all kinds of illnesses, that pellagra. So you can't be without these things. They're vital. They originally started out with the title vital amines, thinking that they might be proteins, amines, but vital amines, vitamins and minerals. Well, first of all, is when you feed a isolated, concentrated nutrient, be a vitamin or mineral, what happens is you create imbalances in the system. Let's just take a look for a minute at the cellular level. That means inside the cell. At the cellular level, we have inside the cells, we've got various receptors, places where these particular substances, minerals and vitamins, they interact with the body, with the cells. And these receptors are very specific. You got receptors for iron, receptors for carotenoids, receptors for ascorbic acid. You got receptors for lots of different things in the cells. The receptors, they bind with the nutrients and cause the kind of reaction you're looking for. Let's take one particular commonly consumed supplement, which is beta carotene. Beta carotene is the plant form of vitamin A. Vitamin A, retinol, is quite toxic. But let's just take a look at beta carotene. Figured it comes from a plant, it can't be all that bad. Well, experiments done where they tested the effect of beta carotene on whether or not you developed a fatal cancer was done back in the 1970s and 80s. What they did is they took people who have a high risk of cancer. These are people who worked with asbestos or smoked cigarettes, and they got lung cancer. They took a group of them, put them on beta carotene supplements or placebos, and what they found is those on the beta carotene supplements had 38% more cancer than those who didn't get the supplement. And I've been experiment after experiment repeated this design, comparing placebo to isolated concentrated nutrients. They've done it for folic acid. They've done it for vitamin E. There's even studies in China on vitamin C that they've done and found to be some negative effects on your ability to stay healthy. Well, what happens is when you take an isolated concentrated nutrient, that nutrient floods the receptors. Going back to our cellular example, inside the cell, we have receptors for a class of vitamins or substances, plant substances called carotenoids. So all the carotenoids, and there happen to be about 600 of them in our natural surroundings, in our environment, there are about 50 carotenoids that we need to be healthy. All of those carotenoids attach to this one receptor, this carotenoid receptor. If you take and you flood this receptor with beta carotene, where are the other 49 carotenoids going to attach to do their job? They can't. They get flooded out. You create nutritional imbalances. You increase your risk of cancer and heart disease and death by creating these nutritional imbalances. You do the same thing with vitamin D. You take pills or shots of vitamin D, over 1,000 international units a day. And what happens is you damage the nerves and the muscles. You have an increased risk of falls and fractures. You don't want to consume these in their unnatural form. In addition to being a big waste of money, is you end up creating more disease. You need to eat the vitamins and minerals in their natural form, which is fruits and vegetables. Now, the exception to plants providing your vitamins, and they do, 11 of the 13 known vitamins. 11 of the 13 known vitamins are provided by plants or the natural activity of the bacteria in your intestine on plant parts. 11 of 13. Which two don't? Well, one is not a vitamin. It's a hormone. It's called vitamin D. But we used to know it as the sunshine vitamin. Get it from the sun. Action on your skin. Converts plant sterols into vitamin D. Vitamin D is not a vitamin. So now you're down to 11 of the 12. And the 11th vitamin is B12. And B12 is made by bacteria. And my argument being that we used to get in a lot more bacteria than we used to before we got so fanatic about hygiene. The other thing you need to know is disease from B12 deficiency is almost unknown. There are a few cases reported in the scientific literature, and they're rare, and they're a little bit confusing. But let's just say there are a few cases of B12 deficiency, actual disease, blindness or neurologic problems or so on, not just some biochemical changes that occur when you have a low B12 diet. No, I'm talking about real disease. 1 in a million, maybe. You got maybe 1 in a million chance of a problem from too little B12. B12, as I said, was made by bacteria. The reason that animal flesh has a lot of B12 in it is because these animals eat a lot of bacteria, and some of them actually have little bacteria fermentation stations along their gut. These are called ruminants. Ruminant animals have 4 stomachs or maybe more. And these are little factories to grow bacteria, which make B12. So they store that B12 in their tissues, their parts, their muscles. And we'll eat these parts we take in B12. No animal makes B12. So, the risk is small. It's a reversible problem until late stages, B12 deficiency. But I wouldn't want to hurt anybody. And I've taken that attitude because I know I get a lot of attention if somebody suffers from B12 deficiency on my watch. So since we started the program, I've recommended that if you're going to be on the McDougall diet for more than 3 years, or you're pregnant or nursing, you should add a non-animal source of B12 to your diet. How much? Not much. It takes about 0.3 micrograms to correct B12 deficiency, pernicious anemia. A very severe disease. It takes about 0.3 of a microgram. I recommend 5, in other words, more than 10 times as much, 5 micrograms a day. Where you're going to run into problems is that you can't buy the smaller dose. You can only buy like 500 micrograms or 5,000 micrograms, far more than you would probably ever need. But that's the way they're sold. So far, I haven't decided that B12 causes any harm when taken in excess, but I reserve the right to change my opinion on that. Right now, we recommend 5 micrograms a day on the diet for more than 3 years, pregnant or nursing. And that covers all the issues. Can't criticize the McDougall diet for protein, amino acids, calcium, vitamin K2, whatever you want to throw at it. It doesn't make any scientific sense. And you know how to handle the B12 issue, which is more emotion than reality. But it could be an issue for some people. I just deal with it. Take your B12. Let's get on with things.